My name is Borge Nordestgaard. I'm professor at Copenhagen University Hospital in Denmark. At the same time, I'm president-elect of European Atherosclerosis Society, being president starting January 1st, 2025. Here, I'm going to talk about the causes of atherosclerotic cardiovascular disease and atherosclerosis. And so it's three causal lipoproteins: LDL cholesterol, it is lipoprotein a, and it is remnant cholesterol. We have heard a lot about LDL cholesterol over many years because the main drug target for LDL cholesterol is statins. But we can still improve a lot, namely by making sure that LDL cholesterol is brought down as much as possible, high-intensive statins, and if possible, even other LDL-lowering drugs. And then, maybe even more importantly, particularly in patients with acute coronary syndrome, right away give them max LDL lowering. So don't start with a low dose, but max thing, both high-intensive statins and some other drugs on top of it. Then we have lipoprotein a, which is an LDL-like particle, but it has an extra protein on it, and it's at least 90% genetically determined. And we're just getting to understand it. But what we know is that if you have high concentration, you have very high risk of atherosclerotic cardiovascular disease. Maybe not atherosclerosis, but on the background of having atherosclerosis, you have a much better risk of getting myocardial infarction, stroke, and also aortic valve stenosis. As we don't have very good LDL lowering drugs yet, they are coming. There's 3 large phase 3 trials ongoing. The first will publish results, I think, early 2026. Then for now, what we do is we give them high-intensity statin, all you can do, and then you talk with them about lifestyle so that they live optimally. And then finally, we have the remnant cholesterol, which is a really big problem in India because of the obesity epidemic. And where you see high remnant cholesterol is the patients that have high triglycerides, particularly when they get it on top of statins. And these patients are often the ones with obesity or diabetes. What you will do with them is, like for the 2 other ones, high-intensity statins, and then there's some options to put fibrates, bezafibrate or fenofibrate on top of it. That is the best option you have now. Again, here there's new drugs being developed that are very efficient at lowering remnant cholesterol, maybe 50 to 80%, but we have to wait for these studies. Thank you so much.